You have been lied to about high blood pressure, not by one person, not by one doctor, but by the way we have been taught to think about it. Because you were told it's salt, it's stress, it's age, it's genetics. But none of those explain where high blood pressure truly begins. It doesn't start in your arm, it doesn't start with a cuff, it doesn't even start when the numbers go up. It starts before you are born. And once you understand that, you will never look at blood pressure the same way again. Let me show you the truth from the very beginning. Before you had a heart, before you had arteries, your blood pressure was already being programmed. At 3 weeks of embryonic life, your heart begins as a simple tube. It doesn't pump against resistance yet. There is no hypertension, only flow. As development continues, blood vessels form from mesoderm cells in a process called vasculogenesis, then expand through angiogenesis. Here's the key. Blood pressure rises only as a resistance is created. Resistance appears when vessels specialize, smooth muscle layers form, endothelial cells begin regulating tone, and blood pressure is not random. It's a response to vessel structure. Blood pressure exists for one reason only: to deliver oxygen and nutrients without damaging organs. Healthy arteries are elastic, responsive, alive. Each heartbeat stretches them. Each relaxation protects your brain, kidneys, and heart. Your blood pressure number is not a disease. It's a measurement of how hard your heart must work to overcome resistance. Inside every artery is a layer, one cell thick, the endothelium. This layer releases nitric oxide, controls dilation, prevents clotting, reduces inflammation. When healthy, it leads vessels relaxation. When damaged, it leads vessels constriction. No flexibility, no forgiveness. Blood pressure rises not because your heart is stronger, but because your vessels are weaker. This damage doesn't happen overnight. It begins quietly with insulin resistance, chronic inflammation, oxidative stress, excess visceral fat, poor sleep, constant stress hormones. These injure endothelial cells year by year. The arteries stiffen, the pressure climbs, the cuff finally notices decades later. Salt doesn't create hypertension. Salt exposes damage. Healthy vessels and healthy kidneys lead to salt tolerance. Damaged vessels and stressed kidneys lead to salt sensitivity. Salt is not the cause, it's the amplifier. So when arteries stiffen, kidneys sense low perfusion. Renin-angiotensin system activates. Salt and water are retained. Volume rises, pressure rises, and damage worsens. It is a self-feeding loop. Blood pressure medications lower the number, reduce risk, save lives, but most do not repair the endothelium. They manage pressure, not vessel health. That's why stopping them often causes blood pressure to return. Here's the part that changes everything. Endothelial cells can heal. Studies show improvement with insulin sensitivity, physical activity, sleep restoration, stress reduction, anti-inflammatory nutrition. Blood pressure often follows vessels healing, not the other way around. High blood pressure is not fate. It's not just age. It's not just salt. It's a story written into your blood vessels over time. And if you treat the cause, it's just a number. That story can change. This is only the beginning. In my next video, I'm going to explain blood pressure is not a disease, and here's what it really is. And also, I'm going to explain why blood pressure starts rising years before diagnosis. Thank you for listening.